Good morning, or I should say good afternoon, everyone. Welcome to the Osher Center for Integrative Health here at the University of Miami. We are delighted to have our guest speaker today, Mark Nestor, who's going to talk about healing the healers and transcendental meditation. I want to take a moment to thank the Wolfson Foundation for the support for this very important series that we have of ongoing excellent talks. I will turn it over to Laura Redwine, who will do the introduction for Dr. Nestor.
Hey, thank you, Dr. Schwartz. So I would like to, very happy to introduce you to Dr. Mark Nestor. Dr. Nestor received his M.D. from UCLA Medical School of Medicine and Ph.D. from the UCLA School of Medicine in Immunopathology and completed his dermatology residency at NYU. He's a fellow of the American Academy of Dermatology. Dr. Nestor is a board-certified dermatologist and serves as director of the Center for Clinical and Cosmetic Research and the Center for Cosmetic Enhancement in Aventura, Florida. He's a voluntary professor in the Department of Dermatology and Cutaneous Surgery and the Department of Surgery, Division of Plastic Surgery at the University of Miami Miller School of Medicine. Dr. Nestor is current president of the American Cutaneous Oncology Society. As director for the Center for Clinical and Cosmetic Research, he has conducted more than 150 FDA and non-FDA clinical trials. He has authored over 150 articles and book chapters, has delivered over 1,200 major presentations around the world. Dr. Nestor is a practitioner of Transcendental Meditation. He's been practicing for over 50 years and credits Transcendental Meditation for enhancing all aspects of his professional and personal life. Dr. Nestor was the lead author in the recent published study on the benefits of Transcendental Meditation for healthcare professionals during COVID at South Florida hospitals. And so without further ado, I'd like to introduce you to Dr. Mark Nestor.
Thank you, Laura, and thank you, Dr. Schwartz. It's actually an absolute pleasure being here. This is a little different for me. I primarily tend to lecture and give grand rounds on dermatology subjects, including skin cancer, Botox, fillers, and a variety of other things. And it's really exciting for me to talk about the science of healing the healers through transcendental meditation. And I'm going to start out with, it's interesting, whenever I give a talk, I talk about my disclosures, and those disclosures are usually financial for studies that I do or consulting that I do. And there's nothing like that in this talk. I don't have any financial disclosures. But I do have a disclosure in that I've been practicing transcendental meditation for over 50 years. It's really done incredible things for my life, for my family, for the others around me, and I'll talk about that a little bit as I go forward. What's interesting is that I realized that in doing that as a scientist, I wanted to make sure that my subjective experiences didn't really color my talk at all, because I really want to present the scientific relevance of this as well. So you're going to hear really an objective scientific presentation on transcendental meditation, and at the end, especially talking about the effect on healthcare providers. I'm also part of the board of directors for the David Lynch Foundation and the Center, or the Institute for Mental Health and Resilience, which is a nonprofit. And I want to thank Stuart Rothenberg, who's the national director of the David Lynch Foundation and Heal the Healers Now, for some of the study material, et cetera, that I'll be presenting. So why are we talking about this? Well, I think the reason we talk about any of this is stress. And as we all know, that stress, including post-traumatic stress, is epidemic in the United States and around the world. It has been shown to impact all areas of physical and mental health. It's linked to death, leading causes, cardiovascular disease, cancer, accident, suicide, across the board. And this great little article from Andrew Weil talks about the fact that up to 90% of primary care visits are due to stress-related problems, half of all US adults, and I think it's probably even higher than that, suffer from adverse effects from stress. Things like workplace violence is associated with stress, and a lot of work is missed because of that as well. And we know there's probably two ways of describing stress. People talk about eustress and distress, but the aspect of stress is a normal part of our life. It's part of the fight or flight response that we get to battle or escape. And the idea is it focuses our attention, it heightens our senses, raises our blood pressure to prepare us for fight or for escape or for flight. The problem is that we're not doing that most of the time. We're really not in our primal need for fighting or flighting in terms of our life from an animal or from another person. It's really about what's happening in our life. And the problem with that is this stuff doesn't go away. And so we have chronic stress. And chronic stress has been shown to deplete the body's physiological and psychological resources, and reduces our ability to cope without question. Now, we know physiologically this has a very significant response on our body. The adrenal hormones, we know that cortisol levels go up, but after a time, the system actually can fail, and we cannot really project that hormonal response that we need to in response to stress, and that really fatigues and causes significant problems with the system. And we know that there's really two types of stress that we see primarily. One is the traumatic stress that we see that leads to fear, anger, sadness, based on a situation, a traumatic situation, and this usually passes. This is something that we deal with at some degree every day of our life with different levels. Post-traumatic stress is what we talk about more and more, and it's all the symptoms, but it really doesn't go away. It's something that we relive on, this post-traumatic stress syndrome that we see. We know that the psychological sides of stress are very significant. And the difference is, again, the idea of temporary, which is situational anxiety, anger, or depression, which is a response to trauma and then it passes, or chronic trait anxiety, anger, and chronic depression, which has to do with persistent levels. And this is really what more and more that individuals are facing. And we know that the toll, especially of anxiety, is very high. It's one of the most common mental health problems. Significant anxiety, and that's an interesting bar, is at least 18% of the population, is probably much more, predisposes to chronic diseases and impairs our health by habits such as tobacco and alcohol. And healthcare providers are particularly feeling this aspect of stress and what has been called burnout, which has become a national crisis, and it's affecting patient care, contributing to shortages, and it costs, in this study, an estimated $4.5 billion annually. And burnout is the state characterized by emotional exhaustion, depersonalization, and that's very detrimental to our patients, and decreased sense of personal accomplishment. And we know that to treat this, there are a variety of ways. Pharmaceutical and therapeutic interventions have been looked at, and there have been inroads from here in the treatment of stress and burnout, including PTSD. And it's interesting because if you look at individuals, there's variations in this, but a lot of individuals these days are suffering to some degree from PTSD and are triggered from that, but they're far from ideal, these different treatments. And Transcendental Meditation, we'll call this TM, is an effortless mental technique that I'll show you that allows a practitioner to experience quieter, less excited states of mental activity. And this gives a restful state to the body to purify itself essentially from the stress and get this restful alertness. And TM has been found to be effective in reversing and reducing adverse physical and mental stress. I'm going to go through the studies. There are literally over 400 studies on this. And I'm certainly not going to go through all these, but we'll go through a variety of these on exhaustion, insomnia, trauma, and increases resilience and other positive factors. And in healthcare providers, a lot of these have been studied now because the David Lewis Foundation launched, they'll talk about this, to Heal the Healers back in 2020 to fund studies, and this includes the Miami study that I'll discuss. So what is Transcendental Meditation, or TM? And the idea here is that it's about settling down the mind, and with that, the body settles down and rests as well. And TM is simply a mental technique that's very simple to improve stress and resilience. It's not a philosophy, not a religion, not a belief system. Easily added 20 minutes twice a day to the daily routine, no changes in lifestyle, does not require concentration, contemplation, or mindfulness. It's different than those techniques. And the idea is that this transcending part of this is experiencing internally progressively quieter states of mental activity. And this restful alertness is not sleep, but a deep state of rest while we're alert. There are over 400 peer-reviewed studies and over $33 million in NIH and Department of Defense grants that supported this. So there's a lot of data on this. And this little image here, this is this bubble diagram looking kind of at the ocean, gives you a sense of really what TM is versus everything else. The active mind is kind of like the surface of the ocean, where we think about things, concentrate, contemplate, do mindfulness, guided imagery, and we're stuck kind of on that thinking plane. The idea of TM is that through this technique, the mind settles down, it goes to the deeper levels, this inner silence, and this is correlated with a deep physiologic rest and brain coherence. And the idea here is to quiet the mind, really rest the body so that it can help purify itself and work better. And that's really the key aspect for this. And it's really the opposite of the fight or flight response here. You get decreased respiratory activity, decreased heart rate, decreased blood pressure, decreased muscle tension, etc. It is the opposite of the stress response. So I'm going to go fairly quickly through a lot of the data here, and I'm going to separate it out into physiological changes, physiological and health benefits, including benefits psychologically, and then even to the system, in other words, the cost of healthcare. And then I'll shift to aspects of healthcare providers and the data on Heal the Healers as well. So as I said, the idea here, and I'm going to present study after study that's been looked at in peer-reviewed journals, there is a physiological relaxation, as I've talked about it. This is a meta-analysis that was done, one of the early ones, which showed a significant decrease in things like plasma lactate, respiration rate, and basal skin conductance. So it is a restful state during meditation. We talked about the cortisol. Indeed, this was, again, one of the early data on this, which showed a very significant decrease in cortisol levels during meditation, different from relaxation or the controls, highly statistically significant. You can see that change here. And so what this leads to, not only during meditation, but also in activity or in sleep, is a calmer state of the physiological functioning. And this is just talking again about the cortisol levels, which is a change lower in both waking, sleeping, and over the 24 hours. And the idea here, as I said, is in activity, in all aspects, we have a calmer state of the physiology, a more rested, a more resilient state of the physiology too. And that's really what this study is showing here. So the idea here is it's more effective as well for stress, successful for this fight or flight. You get a vigorous response, but you get a very quick recovery here that conserves energy and allows the individual to function better in the long run here. Now, in terms of health benefits, There are multiple ones. I'll go through some of these. There is reduced hypertension. This is a meta-analysis of 17 studies, which shows that TM reduces significantly more than multiple other stress management, relaxation, biofeedback, progressive muscle relaxation as well, which are standards that have been used to decrease blood pressure. And in fact, the American Heart Association has specifically looked to TM to be considered in clinical practice to lower blood pressure. And the difference is that the study material from TM is much more significant than with other meditation and other relaxation procedures. So they really look specifically for this as well, based on the data. Now, if you think about it, the other correlates to this are things like heart disease. So this is a study which showed both at exercise and maximum workload, decreased symptoms of angina versus a control group. Again, highly statistically significant here. And from that also, atherosclerotic heart disease. This shows in an African-American population with hypertension, which is obviously a big population for risk factors, showing a decrease, a significant decrease versus what's known as health education, which is, essentially telling individuals to have a healthier lifestyle, to calm down, etc. Meditation has a clear advantage of this in these individuals, showing change in carotid media thickness. And patients with heart disease, this study here shows improvement in the functional capacity in congestive heart failure patients. Again, statistically significant improvement there. And improved cardiovascular reactivity. This is actually interesting. This is just after 2 months of TM practice on a drive simulator. And this allowed individuals to drive faster with less elevation of blood pressure. And this was a test as physiological rest and the ability for cardiovascular reactivity and functioning from there. If you think about this moving forward, if you have less aspects of hypertension and angina and heart disease in general, you're going to theoretically have less heart attacks, strokes, and death. And indeed, this study showed a 48% reduction in lowering heart attack, strokes, and death in the 5 years following with TM versus health education. So again, this is very significant from that perspective for health. This is another study, which is a 10-year study looking at heart attack, stroke, and death, which are, of course, the number one aspects of deadly risk factors. And this is in heart patients. So you can see, again, a significant improvement in this Kaplan-Meier curve on survival going out 10 years. So people who practice this physiologically then are showing them to be healthier in many different ways from these studies. Thinking about that, the next aspect is, okay, if people are healthier, does that reduce healthcare costs? And this is something that is constantly discussed in terms of looking at this. And indeed, this is one study that showed across the board, of course, not with childbirth, that makes sense here, but a highly statistical decrease in hospital admissions in this case across the board for many, many physical and mental disorders, decreased hospitalization and doctor visits in all categories. You can see here hospitalizations on the left and doctor visits on the right for medical care and utilization. And this is a very interesting study. This is a 15-year study from Canadian systems. So it's a capitated system, so they know exactly what they're spending. And what you're seeing here is before learning TM through the mid-'80s, and then after, there was a tremendous diversion in the cost of care for the non-TM group versus the TM group here. So again, the idea here is that if people are healthier, they're going to the doctor less, they're having less procedures, and they're spending less on healthcare from there. So let's switch from the physiologic now to the psychological benefits and behavioral benefits of TM. We talked about anxiety. That's obviously one of the hallmarks of stress and the effects on the psychological aspects. And this is a study that showed both high anxiety and moderate anxiety, significant reduction after starting to practice TM. This is a meta-analysis of 16 studies. Another meta-analysis, this 146 studies, looks at a variety of different types of meditation and relaxation techniques, and the effect size for TM is significantly higher than all of the other techniques. And what's interesting is a lot of the other techniques themselves are no different than placebo. And that's something that we should think about when we're looking at these techniques as well. This is another one. And again, as you know, the number one technique that is being discussed and utilized on the internet is mindfulness. And this is a meta-analysis looking at all study subjects versus study subjects with elevated anxiety of mindfulness versus TM. And TM certainly has a higher effect size than the mindfulness procedure. And this is another study, meta-analysis of 30 studies for mindfulness and other techniques as well, versus the TM, showing a significant reduction from there. Now, we go from the psychological aspects to what I would call the behavioral aspects of it. This is an interesting study that looked at anger in prison inmates in Wolfson prison. And the idea here is we're looking at verbal assault, hostility, irritability, negativism. And what you're seeing here on the right is the control, which either same or worsened. And those who started the Transcendental Meditation technique here showed significant decreases in all of these negative behavioral attributes in these prison inmates, which is a very, very difficult population, to say the least. Habit-wise, this is another aspect. When stress goes down, the stress-associated habits can also go down. This is a meta-analysis of 131 studies on decreased nicotine cigarette use. And in fact, TM was much more effective than pharmacologic, counseling, and other techniques. Alcohol use similarly, and this is peer influence, relaxation, DUI, and different educational programs showing a higher effect. And drug abuse. This is the other part of it. It's a meta-analysis of 70 studies, again, showing a better significant effect with TM than the other techniques. Now, we talk about psychological, but one of the things we discuss a lot these days and look at, especially in groups such as our veterans and healthcare providers, is PTSD. This is a group of studies from veterans showing very significant changes versus psychotherapy for PTSD with TM. And what you're seeing here from it are really the hallmarks of PTSD, whether it's stress reactivity, depression, insomnia, anxiety, the use of alcohol, employment problems, a very, very significant difference and improvement with TM versus psychotherapy. On our military veterans here, this is showing the difference of TM versus what has become the gold standard, which is prolonged exposure and health education. And again, with all of these different models, these are all highly statistically significant and clinically meaningful for the veterans with PTSD. This is brand new. This is a meta-analysis that was just published of 61 studies with over 3,400 subjects divided into mindfulness-based stress reduction, which is the second column, mindfulness-based other techniques, MBO, other meditation versus TM. And what you can see here clearly is that in all these cases of all groups with PTSD, military and civilian, TM showed significantly better improvement in all of these categories from there. And again, this was just published, this study. What's so interesting is that this is another study which showed what happens time-wise is that there's a rapid reduction in PTSD symptoms. And what you could see is even within 10 days, there's a dramatic reduction after learning TM with a reduction in PTSD symptoms as well. So we talked about reduction in the negative aspects, in the stress-associated aspects of life. What can TM do anything about improving the quality of life and longevity? One of the things that TM often touts is the Maslow scale of self-actualization and positivity, just from the technique itself having nothing to do. And indeed, this is one study that looked at this Maslow scale as a meta-analysis of 42 studies on self-actualization, very significant size effect versus relaxation and other meditation techniques. The next two are very interesting. It's looking at the elderly population and what it's shown in versus mindfulness, relaxation, and no treatment is feeling less old in the elderly. And that's something I can tell you as I'm about to turn 70. This is one of the things that TM subjectively has really done for me in terms of both feeling physically and mentally much less old. So I identify with this. There's no question about this. This is showing improved cognitive flexibility as part of that same study in the elderly. And again, a very significant difference of TM versus mindfulness, relaxation, and no treatment. Again, this is correct post-testing of cognitive flexibility. And ultimately, we're talking about longevity. The TM, this is the percentage of people who are alive practicing these techniques after 36 months. And you can see this is a very, very significant effect of TM versus the other techniques on longevity, on staying alive and being healthy. This is another one of this aspect in the older subjects. This is mortality. And again, you can see in this Kaplan-Meier curve, there's certainly a difference, especially in the first 10 years of TM versus the controls for here. What about enhancing intelligence and well-being? Again, part of this same thought process of the positive aspects. What's interesting is one of the earliest aspects that was looked at was EEG coherence during meditation and after meditation. And the idea here is that if the brain is working better coherently, thinking is clearer, we can assess more aspects of creativity and positive use. And this showed an increase in synchrony. And this showed, this series of studies showed increase in alpha-1 EEG coherence during the TM practice as well, which showed this issue of the mind working coherently much better. And because of this, a number of studies have been looked at to look at different aspects of clarity of thinking, of concept learning, of academic performance, of moral reasoning and emotional stability, of neurological efficiency, of self-esteem. All of these are associated with TM. They've been studied, and it's also associated with this EEG coherence. And the idea here is it gives the individual the ability to cope better with stress and with life, and to be able to have better choices, let's say, better ability through creativity, through learning, through performance in their lives. Intellectual performance, these are independent tests that were done in individuals who practice TM. You can see creativity, field independence, mental efficiency. All these have a significant effect size in individuals practicing. So the idea here is that a TM can improve intellectual performance. So I'm going to spend the rest of the time talking about the aspect of our healthcare system and healthcare providers. This is an area that I have been very much interested in, being a healthcare provider, living through COVID with this, and really seeing and seeing the effects, especially that the COVID crisis had on our healthcare system from there. And what happened was that this thought process of the stress and PTSD and burnout that was happening during the COVID crisis came to the attention of the David Lynch Foundation, and they started a program called Heal the Healers Now. And it was an initiative to provide meditation to U.S. healthcare providers. This was launched in April of 2020, and the idea was to provide instruction and follow-up for frontline healthcare providers. Programs now have been implemented in over 90 hospitals and medical centers nationwide. There have been at least 8, there's actually the 9th now, formal research study out of this, published studies from, and I'll show you, Brigham and Women's, Duke, University of Michigan, Moffitt. I'll spend a lot of time on my study that was done here at 3 hospitals. And the idea here is to look at, through these studies, the effect of TM on the healthcare provider system. So this is the Brigham and Women's study. This is emergency room physicians. And the idea is this is at or near the height of COVID. And the MBI is one of the key scales for emotional exhaustion or burnout. And this showed a very significant effect at both 2 months and 3 months after starting the procedure. This is depression and anxiety. Again, highly significant change in those individuals starting the TM technique on these emergency room providers in Boston at Brigham and Women's. And this is perceived stress and sleep disturbances, 2 very significant aspects of both PTSD and burnout. So again, this was a very important data point and study for this. And overall, this was also important to say, is this something that can be done easily and be incorporated easily? And the feasibility of this was very, very high. Individuals practice the meditation at home. They recommended it to a friend. They found it very helpful during COVID. It added to the overall well-being, and the vast majority continued the practice after the study. And I think those are very important metrics from this aspect. This is Duke, the Duke study, and this was, again, a healthcare worker study during COVID. There was a treatment as usual group, meaning counseling and other aspects for assessing and treating burnout and stress. But you can see here there was a dramatic, statistically significant difference between these 2 groups. The TM group showing a high reduction in the MBNI emotional exhaustion. Again, these are similar types of studies showing anxiety and insomnia going down in this healthcare worker group at Duke, and big difference from the treatment as usual group. And again, this is another study on medical students. Medical students certainly have had a dramatic effect as well, in addition to the clinicians, on during the COVID crisis, and showing a very significant difference in the Maslow burnout inventory, emotional exhaustion, the generalized anxiety. And what is nice is the positive aspect of the brief resilience scale showed significant improvements in the positive aspect of resilience as well from these students. This is a nursing study in Central Florida, randomized controlled trial showing significant decreases in general anxiety disorder and PTSD, showing a very significant effect at 1 month, followed by 3 months as well. And again, a positive effect. This is an interesting index called the Secure Flourish Index, a positive index showing an improvement over this time frame. Again, at 1 month, you saw the vast majority of this improvement from there. This is a study of nursing students and instructors, an 11-month study in New Brunswick, and overall, very similarly enhanced vitality, sleep, decreased stress, relationships were enhanced, positive views, and enhanced clarity. All of these things that you saw were studied very early on with TM are very practical aspects, in this case, in nursing students and instructors in Canada as well. So what happened was that in the beginning of 2020, I was approached by David Lynch Foundation and individuals here in South Florida to say, you know, we're going to look at this program in South Florida hospitals, Heal the Healers. Is this something you'd be interested in studying? And this is really what I do. I do clinical studies. I thought this was really exciting to do because, again, subjectively, I thought TM worked very well. There was good data coming out. And this is our publication. And what's interesting is, I'll tell you, I've published over 150 papers, primarily clinical and aesthetic. PLOS1 was one of the most difficult journals I've ever. It took me almost a year to get this published, going back and forth, but I'm very proud of this one, actually. And it's improved the mental health and well-being of healthcare providers during COVID-19 epidemic. It's a parallel population study, and I'll go through this. It's open access. You're able to assess this through the internet whenever you want. I want to thank a lot of individuals in South Florida at Mercy Hospital, at Baptist, and Encompass for helping with this study. My sub-investigators were my fellows at the time, and they were great. And then Stuart Rothenberg, Sandy Ninich, and Maxwell Rainforth were great in terms of giving some resources, especially Maxwell for statistics as well. And the primary objective of this was to look at healthcare workers' burnout, emotional exhaustion, symptoms, anxiety, and depression through this aspect of studying this Heal the Healers initiative of starting individuals on the Transcendental Meditation program. It was IRB-approved study. It was 65 healthcare workers in the 3 Miami hospitals that I talked about, and a control group practicing life as usual. They were all matched as best as possible for gender, age, type of healthcare provider, doctor, nurse, etc., and work schedule. What's interesting is that because of COVID, for the first time, we were able to take some of these validated measures, the insomnia severity, Maslow burnout, brief inventory, and use these through an app online so people could actually do this on their phone. So they didn't have to come in. So the rate of acceptance of this and compliance was extremely high. What I wanted to do is see how quickly this occurred, the benefit. So we looked at 2 weeks to start with, 1 month and 3 months, and they did daily diaries. These were the validated measures: the brief symptom index, insomnia severity index, Maslow burnout, and Warwick-Edinburgh mental health well-being. So this is the positive index of well-being as well. So The study took about a year. There were 123 completed the trial through 1 month and 116 through 3 months. So it was very high compliance. The survey compliance was also very high, and meditation compliance was also very high. Between 77 and 88% of subjects completed all meditations at various times. There were no adverse events. I'll talk about the results here. So the BSI-1, this is somatization. So somatization is the physical aspects of stress that people feel. What's so interesting, and you'll see this repeatedly, is as early as 2 weeks, there was a dramatic, and in this case, a 50% reduction in the somatization of stress. And this went down to 60% in month 1 and 3. So you saw a very rapid reduction. These were highly statistically significant. Depression, similarly, almost 50% at week 2, going down even further at 3 months. Again, highly statistically significant. And anxiety, and this probably is one of the hallmarks, as we talked about, of stress and of PTSD and what people were feeling during the COVID crisis. And you can see here dramatic at 2 weeks, close to 50% reduction in anxiety, going down to 60+% at month 3. The combined BSI, again, showed similar results of 50 to 60% reduction. The ISI is the insomnia index. And again, you see a dramatic improvement in sleep, highly statistically significant at week 2, continuing and improving through 3 months. The emotional exhaustion, MBI, again, a significant reduction at week 2 and a very dramatic reduction going to 3 months. And then the positive index, again, within 2 weeks, and the percent change here is different than in the others, the negative. This is very highly clinically or a positive, significant at 10 to 20%. And you could see here a highly significant change in the Warwick scale from there. So in summary of this population, it's a parallel population clinical trial. The benefits, virtually all measures in the TM group showed dramatic, highly statistically significant improvement at baseline at all time points and as early as 2 weeks, and that's important. The lifestyle as usual group did not show any significant changes from that perspective. So I tried to go through many aspects of what I think are the needs of our time. And what are the needs of our time? It's just riddled with stress for all of us, for healthcare providers, for all of our patients, for individuals. Both acute and post-traumatic stress is epidemic, and it's impacting all elements of physical and mental health. And I think that what we see and what we're experiencing as stress and burnout is greatly magnified in healthcare providers. And, you know, this has to do with reimbursement. It has to do with pre-authorizations. It has to do with looking at all aspects of what it takes to be a healthcare provider these days. TM is a simple, effortless mental technique, and it has significant physiological effects that are opposite to stress. And over time, and actually occurring very quickly, increases resilience to stress and reduces risk factors clinically of heart disease, of mortality, of psychological effects, etc. And that's really important because it's really what we need clinically at this time. It also has been shown to improve quality of life and increase longevity. And in healthcare providers, what has been shown in other studies and in my study, it's effective at decreasing burnout symptoms very rapidly in healthcare providers. So I'm going to stop now. I can entertain any questions and discussion that people may have. And hopefully I've answered some of these questions in advance, but let me just get out of here and take this away. And Laura, I'm open to any questions that anybody may have.
Okay, so this was fantastic. So if you have questions, I see there's one already. You can put it into the chat. and I'll read them out and
Okay,
for Dr.
great.
Nestor. So the first question is, are there any, there are lots of great examples of TM and great outcomes. Are there any studies looking at the relationship between healthcare provider TM application and healthcare quality and safety outcomes, I guess, with patient care?
That is a great question, and some of those studies are underway now. It's very interesting. There are studies that show that there is a tremendous relationship between how healthcare providers get along with each other. In other words, the effect of stress on interpersonal relationships between teams, between nurses and doctors, between other things, and patient care. So it would stand to reason that if you decrease the stress and you decrease the way people feel negatively, those relationships will improve. And in fact, there are studies that show that with TM, interpersonal relationships, not necessarily in the healthcare environment, improve from that perspective. So there are studies now that are underway to look at this relationship between people and how they feel with TM and with outcomes in patient care.
Great, great answer. So if there are any other questions, don't be shy. I have a question. So healthcare providers and the rest of us, just society in general, we're all very busy. And so how often does one practice, and how much time, and how do you fit into a busy schedule?
That's a great question. As I said, I've been meditating for over 50 years. It's fairly easy to get in. It's 20 minutes twice a day, in the morning and sometime in the afternoon before dinner. I probably am, as you are, one of the busiest people around. I do so many different things. I see patients, I present, I do research, and I seem to find the time without problem. And what happens is that, in my experience, over time, you become much more significant in terms of how your time gets managed. You think clearer, you're able to manage time more effectively, and you basically do less and accomplish more. So one of the things that happens is that 20 minutes twice a day kind of frees you up more time in terms of being efficient at getting things done. So it's really not something that my physician colleagues who do this, my business colleagues that do this, don't seem to have any negativity, including, I raised kids. There is certainly a lot of time factors in a life that occur, but 20 minutes twice a day doesn't seem to be terribly difficult for that.
I would add a comment that as a family physician, I recommend meditation to all of my patients. And one of the challenges is to actually make sure that people are carrying through with that advice. And so I think that as the Osher Center embarks on our research endeavors, that's going to be something that I think is a challenge, and something that hopefully we can figure out some ways of stimulating people to do it on a regular basis.
Well, it's a great comment, a great question. I think there's two parts to that. Number one, which is interesting, is this is, as I showed you, within 2 weeks, this is something that many people who start meditation, who start TM, within the first 2 days, they feel significantly better. So it's self-fulfilling in the sense that if you feel better, you'll keep doing it. Although I will tell you that for some people, they say, okay, I'm better now, I don't need to do this anymore, from that perspective. What's interesting is habits are now under very good study in terms of how we get our positive healthcare habits. And that includes exercise, includes diet. I think what happens is that with technology now, with apps that kind of remind you. And this is what we did in our study, actually. With our study, what we did is people got a text saying, you know, how many times a day did you meditate today at the end of the day? And that psychological, you know, supertentorial thought process kind of with them to the day saying, you know, I'm gonna have to tell them how many times I meditated during this for this study. I'll get in my couple of meditations a day, and it really worked. That behavioral modification, which we can do now on our phones through apps, etc., can really help us form these habits that are very positive. And meditation is one example. You know, exercise is another one. Eating right is another one. There are many, many things, if we look towards technology, that can be very beneficial to us.
Laura, I saw there was another question.
Yeah, there are some questions. I think you're getting a lot of interest in people who want to learn TM. And
Okay.
I'm wondering if you want to answer any of that, or if we can get Kiki also to
Sure.
answer.
So the bottom line is that there are in South Florida, there is a Transcendental Meditation Center in South Florida. There's one up in Boca. There's one up in Palm Beach. And that's something where the only place to really learn Transcendental Meditation is from a certified teacher. That's one thing that makes it so special in one way, and makes it also so effective, in that it is taught in a very, very specific way so that everybody gets the best benefit and learns correctly. And we have some fabulous Transcendental Meditation teachers down here in South Florida. I'm not a teacher. That's not something I do, but we have great people. You can go to transcendentalmeditation.tm.org for information. There's a center here in South Florida as well, and you can put it up, the information as well for that if you can, Laura. Yeah, so there are a lot of resources from there. The other thing is that in the tm.org, it goes through a lot of these links for what I presented, which are the scientific studies from this. And what's so interesting is that there's been a lot of talk in the media. Yesterday, Bob Roth, who's the CEO of the David Lynch Foundation, I think it was yesterday before, was on ABC Good Morning America talking about the benefits of meditation. There is a UN World Meditation Day that is occurring tomorrow, Friday, and Dr. Tony Nader, who is the head of the TM organization, he's a Harvard-trained neuroscientist, will be giving the keynote for that at the United Nations. So there is a tremendous uplifting of information and excitement on this aspect for meditation that really has come up over a period of time. It's interesting, when I learned in the early 70s, there was this whole excitement early from the Beatles, who learned Transcendental Meditation, and then from a lot of media coverage, and the number of people that were starting at that point were tremendous. And this has gone down. Saturday, thank you, Laura, is World Meditation Day. It's gone down, but more recently, I think what's happened is that the science of TM has really enlivened a lot of interest in this because of the needs of the world, the needs of individuals for their feeling of tremendous stress just in their day-to-day life and in the world today. They feel that they need something, and TM is really there to help from that perspective.
And now that you mentioned Bob Roth, I usually tell my patients about his book, Transcendental Meditation, and many of them have purchased it and come back weeks or months later thanking me very much for having introduced them to it. So that's a
Thank you. I appreciate that. Yeah, absolutely.
Laura, any further questions?
No, I'm reading. So we have a phone number too. I'm going to put in the chat. Then, so Kiki LNB, who's a fantastic TM teacher, is providing us with that information. So I'm putting that there. There's a telephone number. There's also the email address that she's just given me.
So the other thing that's so interesting is, one, in addition to healthcare providers, the David Lynch Foundation has been helping and studying really frontline workers. So firefighters, police, and they've done some incredible work. And you can, if you look at David Lynch Foundation's website, you can learn about this incredible work with firefighters in New York City, which is quite an interesting, intense, stressful group of individuals. And this is something that's going to also occur down here in South Florida, where the David Lynch's Foundation is going to help sponsor frontline workers, including firefighters, police, in bringing meditation to their lives, which I think is wonderful.
Great. Well, I'm going to take this opportunity to thank you, Dr. Nestor, for an outstanding presentation. And my goal is to reach many, many more people in both our internal community here at the University of Miami and, of course, the public. So thank you for presenting to us today.
And thank you so much. It was really a pleasure to do this. I thank you all for having me.
Thank you.
Thank you so much.
Have a